Hello, everyone. It is Monday, February 24th, and you are on for Not Your Everyday Recliners, Patient and Operator Positioning 101 with me, Katrina Klein. If you think that you're here for a perio class, well, I encourage you to stay anyway. It could be fun. All right. So at any time, if you have questions, please put them in the Q&A box and I will address them for you at the end of this 1 hour webinar. In the meantime, to introduce you to myself, I am Katrina Klein. I'm a registered practicing dental hygienist, still practicing 3 to 4 days a week. I am a professional, or excuse me, a fitness competitor and a certified personal trainer, as well as a certified ergonomics assessment specialist. So I look at people in the posture and in the teeth. It's a wonderful blessing and a curse. So join me for the next hour on how you can position yourself and your patients better. When it comes to workplace injury, which is kind of the name of the reason why we're doing this, right? We're having this webinar so we can learn how to protect ourselves. We need to understand that there is actually a real deal reason why we are so interested. That's why there are currently almost 800 people on this webinar right now. And it's because musculoskeletal system and connective tissue diseases are the number one reason for disability claims. Okay, and that is a big number. We're talking almost 3 million people. It is above mental disorders and circulatory system issues and all the other things. Like, this is a real deal situation. So in case you didn't know, you know now, it's real. Now, what do we do to combat that? We come up with ergonomics, and ergonomics is all about preventing the workplace injury for who? For you, the worker, right? It's to make sure that we can avoid having the workplace injury claims, the workers' comp issues, the disability, switching careers, all those things. So we know a few fun facts. First of all, in that study, 142, 230 were back related. More than half were muscle, ligament, and fascia related. And about dentists in particular, we know that 25% of dentists are disabled before they are ready to retire. That is a terrible number. And I have said it before, we don't know this number for hygienists, front office staff, or assistants because we just slowly back out, right? We go and we work really hard, wearing ourselves out until we start having pain, and then we start considering alternate careers, how many tubes of, whitening toothpaste or MLM products can we possibly sell so that we can make up our hygiene income. And it's devastating because most of us, whether you are a hygienist or an assistant or a doctor, we all generally love what we do. And so it's heartbreaking to see it go. I want to help you prevent that. Now, I say that we're still having these problems because of insanity, because we keep doing the same thing and we're getting the same results. There's been a lot of education over the years from different ergonomic specialists, even here in the dental space, and we're still having problems. And so, we want to stop that. We want to stop walking in the rain as if we don't need an umbrella. We do. We need to be able to protect ourselves. Now, the way that we do that is we come at things with a prevention mindset. A prevention mindset would be to release our chronically tight muscles. We're talking about, stretching, foam rolling, yoga, things like that. We're talking about strengthening the body that we're asking to do this very physically demanding job, right? If anybody thinks that their job is not physically demanding, then I question which kind of dental office they're working in. Another thing that we should do is consider the way that we're working with our patients, whether or not we are chicken winging or if we are actually lying our patients back into supine, things like that. Obviously, our workspace, making sure that it is correctly and optimized for ergonomics so that we can get to all of our clock positions and so that we can work with our patients in a neutral position. And then last is making sure that we have equipment that promotes neutral positioning. And we're going to talk a lot about that term. I'm going to explain it throughout this webinar and also so that you can understand where the human body is meant to be and then why we need to achieve it during our workspace or our work practices during the day. Now, oftentimes we do things symptomatically. We come to treat problems as they present themselves to us. We start having pain and it comes fairly regularly. And then we go and we see a massage therapist because, man, my muscles are hurt, you know. And then, the back pain just doesn't go. So eventually we get fed up with that. And then we go see the chiropractor. And we're now subscribing to a monthly or bi-weekly massage and a chiropractic session. And then, we end up with physical therapy because we have a manifestation of pain that just doesn't go away. And we start having functional deficiencies. And there's no amount of wine and Advil that actually will fix us. And so what I encourage you to do is try something new. Try some prevention. Even if you're already in a place of pain, it's just like our patients. They tell us, oh my goodness, my gums are bleeding so much. Well, let's try some prevention, and that's going to help a lot of things. It may not fix everything, but let's start there. Let's start by doing the preventive measures. And thankfully, you're going to be with me for the next hour, and we can talk about those. Now, as I mentioned, stretching your muscles, those constantly contracted muscles will help a lot. And our number one pain point in the body is our neck. And so I'm going to encourage you to do these stretches with me at home. I know you can't see me, but I'm just going to trust that you're doing them. You'll notice in this picture, I'm on my saddle stool. So all of these stretches can be done with your patients or in your operatory chair side. If you're a hygienist or an assistant, while the doctor's doing something operatively, or if you're a doctor and you're waiting for the hygienist to get out of the chair, you can do it. But there's always opportunity to do these kinds of things during the day, in between patients, or in between procedural points where you can take a moment, take just a few seconds to stretch. So let's do this one. Let's start putting your non-dominant hand down at your side. Kind of hold your arm down either on your chair base or under your thigh, and then take your dominant hand and pull your head to the side. You're going to feel a nice big stretch there in the neck. And now I'm going to encourage you to take a deep breath. And you're going to feel it stretch a little further when you exhale. Okay, now switch to the other side. You're going to plant that arm down, that dominant arm down, and this time I want you to stretch to the other side. You're going to feel a much deeper stretch because this dominant side is significantly tighter than your non-dominant side, and it's because we're constantly leaning into the patient on our dominant side. So as you go throughout the day, try to remember to stretch out that dominant side a little bit more, beginning with your neck. Now, of course, we cannot talk about workplace injury without talking about OSHA. OSHA determined that there are 5 major risk injury factors. We have vibration. Obviously, that's going to include our mechanized scalers, our hand pieces, our polishers, things like that. Force, which is your tongues, your cheeks, your stiff lips, things like that. That's what force is. It's also, by the way, the way that we do things within the front office team. So keep that in mind. And then repetition. So, everything that we do in dentistry is in millimeters or micromillimeters. And so repetition is quite literally our life. We have contact stress. That's in the back. That's your fulcrum finger. Business team, that's also going to be when you're typing or when you've got your wrist propped on the edge of a 90-degree platform like a desk. If you don't have a rounded corner of your desk, or you don't have a wrist pad in order to do your keying on your keyboards, and obviously in the back we have keyboards now too, thankfully. This is contact stress. So no one is immune to this, unless you're still working in a paper chart office. No one's immune to this. And then lastly is awkward posture, right? And look at this, guys. This is absolutely crazy, but I cannot tell you how many times I have gone in and I've done training with an office, and this is what I see. And we're all fooling ourselves if we believe that none of us has ever done this, right? There's always going to be that one exception where it's really difficult to get into a neutral position. So what we want to do is we want to alleviate the need to do anything awkward in our posture as much as humanly possible, right? Ultimately, if we can decrease all 5 of the risk factors, then we are going to propel ourselves in a more safe and injury risk void place, because we have all of these things going on, all of them. So let's talk about this for a minute. How hard is it to go from a place where you have practiced in a certain capacity with holding your instrument a certain way, holding your arm out a certain way for, say, 15 years or more, how hard is it to switch that up? Well, I'll tell you that the way that we learned how to hold an instrument is directly proportionate to the way that we have practiced with it. That neuromuscular pattern that we have hardwired into our brains and our muscles as they connect together is something that was learned. And so anything that we can learn, we can unlearn, or better yet, relearn a different way. So we can learn to retract without our elbow up in the air. We just have to dedicate ourselves, our willingness, our consistency, and our time to being consistent with that. And that means that when you're in the moment and you're 7 millimeters deep on the distal of number two, or you're trying to get to the root caries back there and you find that your elbow is up in the air and you've got your head tipped down or whatever the thing is, you stop, you take a moment, you take a breath, you pivot your arm around so that your elbow comes back down at your side, you rotate that instrument, that mirror, so that you can use indirect vision. Or if you're a doctor and you've got, multiple instruments in there, you get your assistant to offer some help with that. But no matter what, we've got to stop and reprogram our body, look at the angles of the way that we're doing things, and how could I, if I had a mirror in this location, would I be able to see? And then insert mirror there. And so the more dedicated you are and the more consistent you are with that intentionality, the more you can learn to fix this neuromuscular pattern quicker and relieve yourself of the pain faster. Now, we have to talk about operatory setup, right? I mean, ultimately, it can be all wrong, as we can see in this photo. So there were things that they did right in this operatory, but infection control is obviously not one of them. And I want to impress upon you the importance of making sure that you are optimizing your space. Now, for those of you that don't know, this is my friend Laura. Laura looks by her x-ray to have been hit by a Mack truck. She was standing up straight in this photo, according to her knowledge, but her daughter just took a picture of her standing up. And so that's clearly not straight, as we can tell. And the only thing Laura did was practice for 14 years as a right-handed clinician in a left-handed operatory. So clearly our operatory space matters. And this is why I'm so passionate about it, because this should never have happened. And it is very avoidable. So the first thing is, if you cannot get to your side of the patient and you cannot adapt to the right hand side of the patient, if you can't switch your dominant hand, then that's not that operatory for you. Either you got to get a new operatory, or you get a new office, but something has to give, and you cannot chronically trunk twist your body up and over someone under load, leaning over to grab instruments on a delivery system that is on the opposite side, or what have you. So the answer is no. On that situation, the answer is no. Your overhead lighting, we really want to avoid that. Everyone in the office, and this includes assistants that are working on patients, need to have their own headlight. Even if you don't have loops, you need to have your own headlight. You need to be able to see with your own eyes the path of light that is going in front of your face. So that overhead light is a big fat no. And when I tell you that I once did an assessment with a hygienist who was having shoulder pain, and I watched her for 1 hour where she adjusted her overhead light 37 times, you can see how that would lend to shoulder pain, right? So we want to avoid that. Now, the next thing is smooth flooring. We want to be able to move easily across the surface of a floor and not with difficulty. And even though, yes, carpet is gross, we want to be able to do it with ease. And so we want to make sure that we're using something smooth to roll on. If you have carpet in your operatory still, go grab a plastic mat from Office Max or such and use that. If your delivery system is behind you, you're going to have to trunk twist. Remember my friend Laura here when I say that, okay? So trunk twisting, we don't just turn around, and we're not meant to be idle in one like statuesque like posture. We're meant to move our bodies, but twisting your spine and leaning over and going under load to look for, say, an instrument or a burr, or look at writing on a route slip. That's under load. And so if you're constantly doing that, that's going to lend to problems. So you really want to have front delivery, where that delivery system, where your instruments and your air, water, and things like that are housed, is right next to the patient in front of you. So that is a key. We want our lighting in the room to be just right. And my friend Cindy Purdy says, the Goldilocks theory, but she's talking about, saddle seating. I talk about it with lights in the room, because we don't want it so bright that it's glaring on the computer screens, and that you're having to squint your eyes together to block out some light. But you also don't need like a spa light ambiance going on with candlelight. You need to be able to see what you're trying to pick up off the tray. So make sure it's bright, and that you're not having to strain. You also want to make sure that everything is close. So bring it in is the name of the game here. You want your accessories, your lasers, or your extra things that you're using, all the adjuncts that we use, depending on what part of it, whether you're in restorative or hygiene, your instruments, your keyboards, your mice, all of these things. They're all within about 12 to 16 inches of you, depending on your length of your reach. We want to avoid going more than 12 inches out away from us. And then also getting to 12 o'clock. We spend a ton of time at 12 o'clock because it's where we do our most ergonomic work, and that's only if we can actually get there. Too often do I find that operators cannot get to 12 o'clock because there's a cabinet behind them, or the chair is placed incorrectly. When I say chair, I mean patient chair is placed incorrectly in the dead center of the room. So push that chair forward towards the wall a little bit, so that they have less space for their feet that are not hanging off, and more space for you to get back behind them. It's much more important for you to get to 12 o'clock than for them to have an extra 3 feet at the end of their chair. Also, if that's not an option, consider swiveling the chair or moving the chair. Many options on chairs include the ability to swivel it, move it to a diagonal fashion so you can get behind it. If that's not a possibility, come on, doc, help me. Let's move this chair a little bit so we can get to a safer place to work. Now, for you leaners, this one's for you, and I'm going to say that's probably most of us. You can stand while you do this one if you want to, but you're going to take your dominant foot and you're going to cross it over your non-dominant foot. And then you're going to bring your dominant hand up over your head, directly overhead, so that your ear and your bicep are next to one another. You're going to lean up against, a surface, or even just in the air, but that's going to require some balance. And then push that hip away. So you're going to really lean into that hip, just like you can see the photo there. That's going to stretch the QL. And you're going to notice again on this one that your dominant side is going to be significantly more tight than your non-dominant side. And again, it's because we are often leaning into our patients on that dominant side. You can do these guys together as a team in huddle. You can do these by yourself at lunch hour, however you want to do it, okay? Now, too often we see these big, huge chairs, right? And I like to call them lazy boy chairs. And you know the ones that I'm talking about. It's the ones where it's like the shoulder width is really designed for like a linebacker, right? A football linebacker. And they're huge, and like they're all about patient comfort. And none of it is about operator ability to get to the midline of the patient where the oral cavity is. And so ultimately, when an operator is unable to get to that midline without having to completely lean over at the hips, that lends to more patient discomfort in the mouth. So yeah, maybe they're getting a massage on their back, but they're having pain when they're getting, their gums are getting traumatized unnecessarily because the instruments are not able to be used correctly, or you're having to really pull on that cheek in order to get to the tooth. And so I'm going to encourage you to kind of forgo some of the bigger, wider chairs. Go for those narrow back chairs. They will have shoulder support there. They will have a place for the arms to be, but really they're there for such a small period of time that, if you're able to get to the midline of the patient, you're going to be creating more comfort for them. Now, hopefully, if you're lucky and you have a chair that has programmable positioning, that makes a big difference. You can set it on auto pilot is what I call it. And I let the patient know the chair knows where to put you, but don't worry, Mrs. Jones, I can bring you up from there. So you start at the bottom and then bring them up. Being able to get to 35 or 36 or 37 degrees. I know that there's one on the market that goes up to 36.5 inches high. And so for your taller practitioners, you're able to do standing dentistry, which gives you a variation in posture. We're going to talk about that a little bit more. Also, the depth of that patient chair. You want it to be as narrow as possible, right? So obviously, while supporting the patient, you want it to be narrow so that you can get your legs underneath there when you are sitting. And then most importantly is the dual articulating headrest. And by that, I mean you have the capacity to lean the head back. You don't just have this flat headrest that is a board that you can't move or do anything with. And then oftentimes we make it worse by putting a pillow on there, and then their chin is completely in their chest. So let's do some things like get some chairs that do things for making the process easier and more comfortable for not just the operator, but also for the patient. So we're looking at something like this, okay? The shoulders are narrow. There is a place for the arms to rest, and the headrest is going to articulate. The back is very thin. So imagine trying to find a place for your legs on that one. It would be very simple. And it goes up really high. Now your headrest position, this is kind of something I like to hone in on a little bit. This is the same chair backing. This patient is in the same position for her body, but the headrest is the only thing that's different. And you can see it's just a matter of where that headrest is placed. And anytime I go in to do an assessment, that's one of the first things that I see and the first things that I correct is that headrest has got the patient head down, their chin is down, the oral cavity is faced forward towards their feet as opposed to up. So even if you have somebody who, they can't lean back, you can put their head up though, unless they've got vertigo. And again, that's one of those rare circumstances because that has to do with the ear. But for most people, this isn't an issue of I can't lean back. This is a trust issue. This is a matter of I need to give consent and I don't feel comfortable giving you the consent to go into the oral cavity yet. And so if you lean them partially back, but their head is up, you can still see into the oral cavity. And then you have your pillows. So stop with the pillows, okay? They don't need a pillow. Use your headrest. Unless you have a Pelton and Crane chair from like 100 years ago, and I can say that because they're no longer in business, and they've got that flat board and no ability to move the headrest back, then you can use a pillow and directly put that pillow underneath their neck. And I'm not talking about the dog bone pillows. Please throw those away. The patient can't turn their head to the left or the right when you put those underneath their neck. So the goal is to support their neck, not the back of their skull. The back of their skull does not need support. It's completely their neck. And so when we put the pillow too high up on the top of the headrest, suddenly their chin is down again. So we've defeated the purpose of putting the headrest back. So get a microbead pillow. You can get them on Amazon all day long for like $10 or less. Make it a small one, or even go get one of those small towels and roll them up and put them underneath their head. You'll find that you'll get the chin up, their neck is supported, and everybody is happy that way. And the words that I used with my patients is, rather than saying, are you comfortable? Because that's what we like to ask them. Are you comfortable? Do you feel good? Is everything okay? Ask them, are you comfortable enough for me to work on you safely? Because what that means to them is that I need you comfortable, but not so comfortable that it's not safe for me to work on you. And when their oral cavity is faced forward, that's not safe. Anybody with a high-speed drill in their hand is going to tell you that's not as safe as if somebody's got their oral cavity facing the ceiling. So saying those words to them, are you comfortable enough for me to work on you safely? They might say, what do you mean by that? And you can explain to them, well, my instruments are designed to work in a certain way. And so without being able to see, there is more risk involved. So the way that we optimally work on you is with your oral cavity faced up. And so it provides more safety for you. And you might be surprised at just how easily it is to get them to put their mouth up. Additionally, one of the first things that I do with a patient in the chair is I tell them, go ahead and come all the way up to the top of the chair. That is, unless it's a very tall person. And the reason I say that to them is It's because these chairs are designed for 6 foot tall humans, which they are. And unless they are 6 foot tall, they're going to need to go up to the top of the headrest. And I always say, what's in it for them? I say to them, because your back and neck are going to be better supported when you come to the top of the headrest. And by saying that, I then follow it up with, after they've scooted up, because they always do, I say, doesn't that feel better? And 99.99% of the time they say, yeah, actually, that does feel a lot better. It's because it does. They are actually being supported better when they go all the way to the top of the headrest. And then you don't need that extra pillow. Now, there are going to be rare occasions, like if you have someone who literally has the no ability, no strength to move up, then you do what you got to do. But those are very few and far between. Now, I talked about the depth of the chair, okay? How much torso do you have? So I'm a 5'1" person, so I don't have as much torso to give. And having that patient chair be short, or should I say shallow, allows me to have the ability to sit for the patient. So again, like looking at this particular chair, it's very, very thin. It's comfortable, it's very cushy, but it's very thin. So, you have the rule of three, in my opinion, where you tell them, basically, let's adjust you here. Don't worry. We're going to adjust you. Don't worry. I can bring you up. I can bring you up. After 3 adjustments of moving them up, you're busy. They want to get through, and you both have got things to do. So like, let's just get it done. And so you're going to give up and you're going to put yourself in an awkward position. So how about start from the bottom? Again, that comes back to the programmable features. I'm going to bring you back to where the chair knows you need to be, but don't worry, I can bring you up. And then if you have 3 times of an adjustment, going from the bottom to the top as opposed from the top to the bottom, you're still going to get way farther into supine than you would otherwise. There's a couple things that we need to be ready for, though, right? Special circumstances, like, if somebody comes in a wheelchair and, they need to be transferred, or you need the chair to move over. Well, you don't always have 3 people in the office available to you to move these chairs over. If you have a gliding system like the Dentalese or the Forest 6400 that has a glide system. You can push a button and it moves over a few inches. Now you have room for your wheelchairs, or someone who has a big walker and you need to move it, or you have 6-handed dentistry going on and you just need to make more room in your operatory. You could do that. So that's something that you can be prepared for. Also, having drop down arms is a really big important feature, because unless those arms completely turn backwards, oftentimes they'll put their arms on those armrests, or their hand on the armrest to hold themselves up, and then it will rotate, and then it's a fall risk, especially for those folks who are not so steady on their feet. And then it's an elephant in the room, and that's no pun intended, but like as a society, we are larger. So rather than worrying about getting a chair that is bigger at the shoulders, why don't we concern ourselves with making sure that we have the weight capacity on our chairs to lift a heavier being, and then also make sure that you've got that extended arm rest at the elbow, and also the forearms, and that takes care of both issues. So these are just some rare circumstances. It's obvious it's not every day that we have to deal with those, but being prepared for them is nice. We've got this next stretch. We have your elbows down at your side, palms facing forward, and then just bring your palms back. And you'll feel a nice deep stretch on the front of your shoulders. These are all things, by the way, you don't need to worry about taking photos. I'll have a stretch card for you at the end. You can take a photo. You can contact me for it to put up in your operatories. These are things you guys can do together. Now, if we're talking about positioning, we have to talk about operator positioning as well. And one thing that you'll learn in this course is that I'm a big proponent of standing part-time in practice for the back office as well as for the business teams. So here's why. When you're looking at this photo, the anatomical photo with the muscle, that's your psoas muscle. It originates in all of the lumbar vertebrae and inserts into the top of the femur. And when you are sitting with your legs at a 90-degree angle where their thighs are parallel to the ground, that gets shortened. Not only does that muscle get shortened, it gets tight, just like when you're sitting in a car ride for several hours. You get up, you push your hips forward, and you stretch out, right? It's no different than how we get that lumbar pull in dentistry when we sit for a long period of time. So we want to avoid sitting in a flat pan chair. And that's one reason. The next reason is that the lumbar curvature that you're supposed to have in regular sitting in a neutral posture or standing in a neutral posture, the discs become unevenly pressured. So that's where this disc bulge comes from, because the back gets flattened out and that's not evenly stacking vertebrae with discs in between. So that flat pan chair is really not your friend at all. I know it's the free one that comes with the very expensive chair, but it's really costing you money, because if you're tired and cranky and hurting, it's not going to be good for you, right? Now, so what chair is the right one? You've got, again, your free standard chair here on the end that you often get with the patient chairs. These are the ones that we all hate. These are the reasons we have a lot of pain. So I'm going to say no to that one, especially in the back office. In the front office, I still encourage different seating up there as well. Can you believe that? I really encourage the yoga ball for business team members if you have a couple of things. One, if you have a pump checker or a pressure checker that you can determine if that pressure is even every day. If it's not even, you're not going to use your core the same way. It's not going to be even pressure, but that's pretty easy to store there. And you don't have to sterilize this yoga ball chair between every hour or every 30 minutes when there's a patient. So that's a little easier to negotiate. Now, that's only if you have a lot of space. The next question is, well, what about armrests? So armrests really should be supporting your arms, your forearms at your side, not out chicken winged away from your body, and with your shoulders completely relaxed. So yes, armrests are acceptable as long as they are adjusted according to your body. If For me, I'm a fairly small peanut, so that means that my armrests really need to be able to come inwards. You need a fully adjustable chair. If you don't have space for a yoga ball chair, a business team member should have a chair that is fully adjustable, so that maybe they have a waterfall cascading effect on the front, so that they don't get the blood cut off or circulation cut off on the back of their thighs because they're sitting in a chair that's too big for them, or that their armrests are too high or out at the side. These are all things to consider. So definitely, if you like the armrest and that's your thing, go for it, but make sure they are adjusted correctly and that they are able to be adjusted for your body. I do recommend a saddle stool because, again, if you don't have the hips, or excuse me, the thighs parallel to the ground, your legs go down, which means that that psoas, or that hip flexor muscle, is not being shortened. It's not becoming tightened, and you are in a much more seated standing position that is closer to standing, where you have a natural lumbar curvature and you're not going to get that same back pain. You get a saddle stool to save your back, okay? Now, the next and last question is, what about a lumbar support? Don't I need that? The answer is no, you don't need that, because if you are sitting in a saddle stool correctly, your discs and your vertebrae are evenly stacked up on top of each other, and you don't need it because your body is holding yourself up. Like, you don't have a lumbar support when you're standing, do you? So why would you need one when you're sitting? You don't have one when you're riding a horse. If anybody's ever ridden a horse before, you don't have a lumbar support for that, because you don't need one. And 85% of the people that put a lumbar support on the back of their saddle stool take them off anyway because they say, I don't need it. Now, there is one company that does have a lumbar support that actively moves with you. And so most people don't use a lumbar support because they don't get it on there. They have it taken off because they don't use it, except for during maybe, reviewing medical history or talking about vacations or case acceptance or whatever, presenting treatment. But if you really like to have that lumbar support, I know of one company that does offer that adjustable, constant moving lumbar support for you. You can contact me after, because if I talk about every product I know, we'll never get off this webinar tonight. Now, let's talk just a minute about passive versus active seating. So you can see right there, like if your legs are up and you can spin around on this chair without going off balance, you can see how the weight is evenly distributed in the spine, using the core to support yourself up. That is active sitting. What you're doing at home right now, very likely, unless you're me, because I'm actively sitting on my saddle stool in my home office, you're using passive sitting. That's what we do on the couch. That's what we do at the kitchen table. That's what we're doing in lectures when we're listening. That's passive sitting. You're not engaging your core to activate those core muscles. And so, we do have other people think we have a sedentary job. Isn't that funny? But the reality is we have a very active job that we do because we're up and down and we're moving around and all the things. We need a chair that allows for that activation during sitting. Again, this is what we're supposed to look like. So saddle sitting 101 is just like any other sitting when it comes to the way that we're supposed to be in neutral, head over shoulders, over spine with your elbows. And the only thing that is not in a line is your wrist. So the only thing that's 90 degrees anymore is your elbows. Your elbows should be at 90 degrees with your hips even. Don't put your one foot up on the caster wheel. Because if you do that, that one foot is going to elevate that one hip. Where the hip goes, the spine follows. Okay, we don't want to do that. And then you end up looking at this guy over here on the bottom with that flat back, the pelvis is tipped under, thoracic spine is forward, the head is lunged forward, and then we end up all looking like Mr. Burns at the end of our career. We don't want to do that. So if we could just take a moment and if we have any dental assistants in the room, if you work with a dental assistant, if you, anything like that, we want to avoid the life preserver theory. Like this is an armrest, and God forbid you fall into that patient during a procedure. How awful would that feel? And I know we want to see everything, but what we can see, especially if we have a light or we have loops, is much better if we are sitting upright. We're using the armrest as an armrest. And you can see in this picture, we have a lot of room here to get in close to that patient. Marry your hip with that patient's shoulder. Stand if you need to. You can get in close without having to lean so far forward. So just remember, if you have a dental assistant and you care about them and you care about your patient, save their back, save their hip, save the patient. No more life preserver dental belly bars, as I like to call them. Now let's talk about spinal load changes. I showed you the way that the anatomy looks. I showed you the curvature of that lumbar spine and how it's affected, but also how about your posture? So if you look at the very first picture, you've got, somebody standing here. This is 100% a gravitational pull. It's 100% of your disc pressure evenly presented. As we go forward, this is a position that much more resembles saddle sitting. So, if you look at here, my back is straight, the hips are down about 135 degrees-ish, and then the legs are down, feet flat on the ground. This is much closer to what we actually look like. It's not a 90-degree angle here. You've got 105%, so maybe a 5% increase in pressure on your discs. That's not a lot, so it's much closer to neutral posture. But look over here. How many of us perch on the end of our seat and look like this? Many, many, many of us. And that shows us that we have almost double the amount of disc pressure. Now, there was a study that showed, that when we are, standing or if we're sitting, that, maybe there isn't the same amount of pressure, but that's, or that maybe there is the same amount of pressure, but that's given the idea that we don't lean in. And the reality is we lean in. Okay, that's just the facts of it. So definitely know that the saddle stool is going to be a lot closer to neutral posture. It's going to allow you to preserve energy. It's going to allow you to reduce the disc pressure. If you already have back pain, you definitely want to be using a saddle stool. Now, what about standing? I told you that I was a proponent for standing. And so, especially if you're a taller clinician. Again, I'm 5'1", so just about any chair is height standable for me, but many people are not. If you're like 5'9", 5'10", or taller, it's going to be a little more difficult depending on the chair that you're using. So obviously I'm going to encourage you to get a chair that's got, 36 or more inches of elevation. But why would you stand? When you stand, it's much easier to get from one clock position to another clock position. You're less likely to have to worry about, well, gosh, are my legs at 135 degrees, or are they at, 110, or whatever the thing is. You just get in there and you do it. And you're going to find that you'll become more efficient. It saves you time because you can get from clock position to clock position a little faster. You can micro shift, meaning that you're changing the weight distribution from one foot to another, maybe leaning a little back, meaning you're leaning a little forward. And so you're distributing the weight differently throughout the day. And what that does is it reduces the amount of chronic compression. So we have compression that we experience in our shoulder when we've got our chicken wing up. We also have it in our hips and our knees. And so we want to reduce the amount of compression that we feel by sitting statically in one place by standing. Now, that said, Yes, does the body feel more, or excuse me, less fatigued because it doesn't take as much energy? Absolutely. But I don't recommend that we stand full time. I highly recommend for hygienists, every other patient, stand and sit, stand and sit. And for dentists, stand for all your hygiene checks to begin with. Have the hygienist bring the patient up to your standing height before you walk in the room. And you might be surprised that you're much faster because the patient's already lying back, the patient's already in supine. You walk in, you grab your instruments, you do the exam, you get out. You're much faster. And so you resent those hygiene checks just a little bit less. You're faster. You don't have to move around the hygienist's chair or bring that patient back from the top and then bring them back into supine. That whole journey of consent and everything has already been established for you. You don't have to revisit it. And so you are faster, makes you more efficient. And I think that you'll love it. Now, if you are going to stand, and most of you that will stand will love doing it, you'll want to do it more, please wear comfortable shoes that give you some support, okay? Because that's not good, and you want to make sure that you provide your feet with enough support to get through the day. Now the question is, but how do I rheostat? You use your toes, okay? So when you use your toes, rather than like the whole foot. So you can see I was first using like the whole half of my foot, but you notice that when I use my look at how much far it goes down. And then when I use my toe, don't you know, it goes down the same amount. These rheostats are extremely sensitive. It does not take a lot to get the same amount of torque or spins per motion out of it. So don't worry, you can still rheostat and stand at the same time. And just use your toes. Now, here's another stretch. And we all talk about our neck being in pain. Do yourself a favor, elongate those anterior neck muscles that are always tight and contracted by pushing your chin up into the ceiling. So when you push your chin up, you can actually feel a deep stretch. And I'm doing it with you, which is why my voice sounds a little funny now. But you can actually get a deep stretch out of your chin or with your chin up to get those neck muscles to be elongated and stretched and give some relief so that you can avoid sometime that you are having some like forward head posture or neck flexion recurring on a regular basis. And that often comes with some neck pain on the back or in the upper back region. Now remember, it's also how we practice. So the way that you practice with your patient, like, are you training them to turn towards you? Are you giving them some time with you? Some time with you actually demonstrating what you want them to do, or do you just say turn towards me or turn to the left, and then they turn their eyes a fraction of an inch and then we're upset because they didn't actually do what we asked them to do? So we need to be very clear with our instructions. Turn way towards me, apply some gentle pressure to the chin towards me, and even do it with them. So as they're seeing you turn your head or put your chin up, or put your chin way up, use words like that, way. That's an adjective that lets them know that it's more than a fraction of an inch, right? And so you can even do it with them. If you put your chin up and you are applying some gentle pressure to, their occlusal of the maxilla, you can give them some guidance. And then you can also give yourself a little neck stretch at the same time. I mean, like, we're multitasking masters, right? Now, also, when we are working with our patients, if we are not using indirect vision, and you know who you are, if that's not your thing and it's something that you're uncomfortable with, I'm going to encourage you to take home your Type It On and get comfortable with it. If you want to get rid of your neck pain, you're going to have to get used to looking through a mirror. And it's not fun, but you got to do it. We got to live, eat, and breathe it. That's just the way it is. But most important, practice these ways so that you can keep the patient's head where you need it to be, continuing to encourage them when they get to the place of where you wanted them to be. Like you said, keep going, keep going. Then say, oh, awesome, thank you. This is going to feel so much better for you. Again, what's in it for them? This is going to be more comfortable for you. And in your head, you're saying it's comfortable for me too, but they need to hear that because that's going to encourage them to continue doing that same behavior. Now, this is another stretch that you can do, just like the car ride one I was telling you about. You get done and on your lunch hour, everybody's doing this. My back hurts. Do yourself a favor, stretch that psoas out, and also get a drink of water. Dental professionals, PSA, you are not part camel, okay? You need to hydrate your brain, your bones, your muscles, everything in the body requires water. Okay, we are 70% water. We need more of it. And I know that means you're going to have to get an operatory next to the bathroom, but like, trust me, it's worth it. You need to be able to do that for yourself. I need you to say this out loud, even if like I can't hear you, and maybe people, your family might think that you're funny for saying this, but like Psychology 101 says that you hear your voice more than any other voice, and that means that you believe your voice more than any other voice. So if you don't say it out loud, it doesn't work. So repeat after me. I am not a chicken. Okay, please just say it. I know it feels funny, but here's why. When you are back in the op tomorrow and you put your arm up and you get your chicken wing going, you're going to hear their voice in there saying, I'm not a chicken. I'm not a chicken. So that's very important to keep in mind, because as soon as you hear yourself saying that, you can pivot your arm around and get that arm down. Remember, this is where you want to be. You want your elbows down at your side. The only thing that's 90 degrees is your bicep to your forearm. That's it. Everything else is nice and neutral. Now let's talk about what we learned in school. Okay. In school, we learned put your chin down for the mandibulars, your chin up for the maxillary, sit up straight, get it done. We want this competency done. Why are you not faster? Right. And that's just not fair, because unless you were in a really great class with an instructor who probably had an injury, chances are you may not have gotten a lot more information. That's why you're here. So this is a slide that I put together of all the different compilations of clock positionings and things like that. So you're welcome to take a photo of this. You can actually also email me and I will send you a copy of this slide if you would like it. And I'm happy to send this to you. But for most things, this is pretty much the easiest one that makes it all make sense. Okay, regardless of whether or not you're doing, surfaces away, surfaces toward, or you're like, I'm going to do this quadrant and that quadrant. This is going to apply to all of it. Okay. Now, the next thing is ergonomic training. So here you are, and you can do it in person, you can do it online like this, but know that everything that you are dealing with is something that is generally individualized for you, because your body, your operator, positioning, your operatory, your equipment, your patient positioning, all these things are different. And so one person's struggles are going to be different from the next person. So if you don't get the answers that you need from this course, you're welcome to reach out to me. But just know that everything is individualized, and so you can get help outside of taking a particular course, no matter who gives it. There's a lot of good information here, but there may be things that you don't get, but you can always reach out for help. Okay. I will tell you, as you can see here, that ergonomic training is the #2 most effective tool behind deflective loops, not just loops, but deflective loops. They call them ergo loops. So the number one training, or the number one factor for reducing workplace injury, was ergonomic training for years and years and years and years. And now, thanks to deflective loops and how effective they are, that is now the number one most effective thing to reduce workplace injury. So if you don't believe it, there are studies to show that it really does work. Okay. This is another stretch, and what I want you to do on this one is don't just put your fingers in the air, put your palm, where your wrist meets your palm, push that up into the air. You'll actually feel a nice deep stretch going all the way back down your arm and into your back. So all the way in the back side of the arm here where your triceps are, and then your back muscles. And that will help a lot, because those muscles oftentimes, they get contracted as well. Aha. So this is the stretch sheet. So there are stretches that we did go over, stretches we didn't go over. This is yours, and you are welcome to have it. You can take photos of it. You can contact me with information requests. I even have it on my website, which, and don't worry, I'll come back to this. But here's my information if you need me, if you want to come hang out with me on Instagram. It's a lot of fun. If you have more questions, if you have burning desires, you're welcome to talk to me. I love helping people, but you can go to my website to get that free stretch card. And now, if it's okay, I'm going to go ahead and answer some questions. Okay. Are dentists eligible for the CE course? Trung, I'm going to say that's a yes. Yeah. I would assume it's eligible for anybody, to be honest with you. I think our phone gazing is also adding to the extra burden on the neck. Absolutely. That's a whole other course that I have, but the digital issue is 100% a thing. So yeah, put your phone up. So the next one is I have an older population of patients and all complain they can't go that far back and need a pill or something else they can't handle, which can be very frustrating. So what would you recommend that I do? So Shannon, great question. So what I recommend for those folks is that you get a microbead pillow. Because even if you tell them that the pillow is built into the headrest, which is what I often try to do first, I move the headrest a little bit to accommodate. Um, I start them back and then I bring them up, but I put a very small pillow or rolled up towel underneath their neck so their neck is fully supported. And I let them know I'm going to put this neck here or this pillow here for your neck. And that way it can be fully supported. And that way they can have that they want to have something to hold on to. And so the next thing that I would do, especially if you have a lot of patients, if that's the majority of your patients, I would really get comfortable with indirect vision. Our dentists from before 1965, they used to only do standing dentistry and they used a lot of indirect vision. That's how they got things done on the maxilla. So you can do it, but it will take a little bit more, and it is frustrating. A lot of the times, we have to be a little more assertive, but it's hard because how do you go about that? But offering them a different kind of a pillow, bringing them back a little and then adjusting them up is a good start. I'm one that works standing, adjust patient chair for working procedure. Adjusting patient chair for working procedure. Thoughts on this? Yeah, you're going to adjust your patient chair a lot. Some patients have a much deeper head. You get them into your what I call the autopilot positioning places, and then you adjust from there. So if you have somebody that like a child, and you're standing, you're probably gonna bring them up a little further than where you normally would, right? Where your autopilot puts them. Adversely, when you have someone who has, say, a very deep head, you might do the opposite. You might bring them down a little bit. And so, yeah, absolutely. Depending on your procedure, you can also change it. Some procedures also, would dictate that the patient sit upright. If you're a dentist and you're looking at an occlusal adjustment, or you're adjusting something on their dentures, that might be a position where you need to have them sitting upright. So there are always going to be exceptions. Okay, do you like inflatable disco sit cushions? So those are actually more for your people who have tailbone issues. Like if you've broken your tailbone, or if you have issues with an SI joint, that's there to relieve your SI joint. So it's really specific to those circumstances. But otherwise, I would say that's probably unnecessary. Hello, what's your recommendation for mobile clinic patient chair that's automatic and lightweight and easy to move around to different places? I have a manual old chair that's so hard to adjust. I'm in so much shoulder pain, lower back and right and hip pain. I'm gonna recommend that you contact me directly on that one, and I can get you a referral to somebody because I don't have it off the top of my head. But definitely there is an answer for you. My first answer is if you've got a lot of pain, we got to look at how the chair is set up in that mobile unit, as well as get you using indirect vision. But yeah, let's get you a chair. Contact me, okay? Let's see. What tips do you have for working on pediatric patients? Oh my goodness, you guys. As far as positioning them and myself, especially with limited cooperative behavior, I do on and off stand when I feel my ergonomics getting misaligned. Y'all, pedo people, my heart just goes out to you. It is not an easy job that y'all are doing. So definitely getting the patients all the way to the top of the chair. We obviously never leave a child on a pedo bed or on a patient chair. I would say, getting with external fulcruming is going to be a helpful tip for you. And keeping the mirror in the mouth. I've found that working with kids, like, they will stay open longer if you've got the mirror in their mouth. And then obviously offering breaks here and there, but just talking to them. My experience with kids is that you're on. You're just on, right? And it's okay, keep turning, keep turning. Awesome. That's great. Give a lot of encouragement for the behavior that you want to see repeated, right? So you incentivize that for which you want to see repeat, and kids love encouragement. So, that's an energy drainer, but that's the life of a pedo practitioner, unfortunately. Any particular stretching techniques? Well, I offered some stretches here and also on that stretch card at the end. Some people prefer using the doorway. I highly encourage that. You're going into or out of an operatory. That's a great way to handle that. But you can also do at-home stretches. So you can use some ropes, and you can use bands and things like that. There's all kinds of different stretching that you can do. What does 4 to 8 o'clock mean? I'm so glad that you asked this question. So when you are almost facing the patient, so you're coming from in front of the patient to floss as opposed to coming from 12 o'clock, you're going to be less likely to chicken wing both arms, because we all know that happens when you're flossing, and that's a flossing position. So when you are flossing, you are not, if you're in 12 o'clock, your both elbows are going to be out, especially on the maxilla. So if you are coming from in front of the patient, you're going to find that your arms can easily pivot down next to your side, out in front of you, less than 12 inches, especially if you're getting up close. So that's a great question. Thank you. Oh, can I go back to the stretch picture? So I'm on their screen. Let me see if I can do this. Let me see if I can. No, it's not letting me. If you've got my website information there. Oh, it's recorded. So this is recorded. You can go back through the recording, but if you contact me, you can get it on my website as well. Um, Mobile clinic. I'm sorry. I totally went the other way. Can you go back to stretch pictures? Hip pain with saddle chair, how to fix posture to help with this. Oh, good question. So, it means that you're on the wrong chair. The first saddle stool that I sat on, it started making things go numb that have no business going numb. And so I didn't know at the time that that meant I was on the wrong chair. I just thought saddle stools were bad. So my recommendation is to get a different saddle stool and make sure that it fits you correctly. The next one is, how do you handle patients that have vertigo? This is a really difficult one because it's almost impossible not to practice with at some point, with an arm up or with your body tilted. But I'd say really, really utilize your indirect vision, because that's going to help you a ton. I almost always stand for these patients because then I can really move. Even if I have to, I'll go to the opposite side of the patient. So I'm a lefty. That means I like to work at 3 o'clock or 1 o'clock or whatever. Sometimes I'll move over to 11 o'clock if I have to, so that I can get and see what I need to see. But that is tricky. I actually had one patient that literally could not turn to the left at all, and he had to see another hygienist. It was so sad. What saddle chair company do you recommend? I personally use a Crown Saddle, by Crown Saddle Seating. What would you recommend for the kiddos? Oh, the kiddos, you guys. I'm so sorry. I think I answered that one now. You're welcome. If a patient says they can't go down all the way, how do we go about that to not break our back? So again, I'm going to move you to the patient, or to the position that, or the chair's going to put you in the position that it knows where you need to be. But don't worry, Mrs. Jones, I can bring you up from there. So you start them at the bottom, and it's okay. And then you adjust them up, and you adjust them up. And I said, like, 3 times generally is about as much as you both need, because most often it's just about consent. It's just about trust. What about receptionists? Any kind of gel type insert for our chairs if we cannot get a new one? Yeah, I mean, they're all over online on Amazon. You can get, I actually recommend getting your own chair, believe it or not. I recommend that for back office too. Like, if you have a certain body type, then you need a certain chair. Get yourself a chair, take it with you. I literally take my saddle stool with me to every temp job that I go on, and it's my own chair because I don't want to have to worry about sitting in something that causes me pain. But you definitely can get a chair that works for you, or you can get an insert, or you can get like one of those, well, he was saying the tube support. And then also, if you have the opportunity to stand at the front desk, getting those risers so that you can get a variation in posture will relieve your back pain as well. Have you seen the reports where people are growing horns due to screen watching? No, I literally have not, but I'm very interested in that. So that would be fun if you want to send that to me. For the ladies, do saddles. Okay, so something that Anne Guion calls fire crotch. And it's awful. That's what I was talking about, things going numb that shouldn't be going numb. And that just means you're using the wrong chair. It doesn't mean it's a bad chair, it's just not good for you. Any recommendation for headlight without loops for assistance? Yeah, almost all of the loop providers will sell you a headlight. You know, like the Luminant people, they will sell you a headlight that goes onto any glasses that you have, safety glasses or not. It just clamps right on there. There's all kinds of adapters. And I think most of the others offer some variety of that. I have two patients that cannot transfer out. I know we got 1 minute left, you guys. I'm so sorry. And if we run out of time, you can definitely contact me with your questions and I will answer every single one of them. I have two patients that cannot transfer out of their wheelchairs, so I have to do their prophy with them in there. Yes, I had a patient like that at my last practice, and I stand for those, use a lot of indirect division. You get an assistant to help you for those patients. That's not something that you take on your own. Do not be a martyr. You're not volunteering as tribute here, okay? Now, hip pain with saddle chair. Again, this is where you're going to want to make sure that you've got the right saddle, but also that that saddle has tilting ability because not everybody has the same hip bones, you know, and it's not the size of the caboose. It's the way that the bones are inside of the caboose. Okay. So when you sit on a chair, you need to be able to bring your feet up and underneath you, you know, swing them up and back, and you'll find that you're either balanced or you're not. And if you're not balanced, that means that you need to be able to adjust the tilt on that chair. If it doesn't have the capacity to tilt, then that's not a good chair for you. You need to get one that has it. I have an anterior tilt to my pelvis. Would a saddle stool exaggerate that or aid in that? Wondering if I would arch my lower back more in a saddle stool. I know some of it is due to leaning in towards the patient. Great question. And the answer is not if you have a stool that fits you correctly. You're definitely going to be, it's going to be more important to make sure that you have the right saddle stool for you and that someone shows you exactly how to sit in it, that you adjust it for your body, that you know and recognize what does not feel right and what does feel right. And so you're, again, welcome to contact me afterwards, and I can help you out with that. But again, just do that swing test, and that's a really good start. You want to raise yourself as high as you can in that saddle stool with your feet flat on the ground, and then swing your feet back and under. And if you can do that and your body doesn't move, chances are you're in the right stool and it doesn't hurt you. That's even better. So like there's a few different tests that you can do. Okay, I feel like I'm going on speed dial here. So that was all the questions there. There's something in the chat here. Oh, it's recorded. Okay. So I'm going to go back up. No, I cannot go back up. So here we go. That's my information. I hope that you guys had a good course. I know that there was a lot of information. And of course, I'm here to help. And I thank you so much. And I thank Viva Learning for offering us this platform so that we could learn together in the comfy of our homes after work on a Monday. Oh my goodness. Thank you so much. I appreciate your time, everybody.